Good, I guess I'll jump in. Hi everyone, my name is Jennifer and I'm with Rethink Synergy. We are a company that focuses in process improvement and change management. My personal background is in healthcare and consulting, and now we're now here we are.
hmm Yeah, it's great to be here with you guys. Yeah, so we'll be doing some of these live streams on LinkedIn to have these discussions. These are the kind of discussions that we'll be having within the network. And if you're interested in joining, you can just reach out to me. And we have a community space that's free. So if you want to join in on these sort of conversations, we want a diverse set of voices. We want to hear from everyone. So just hop on into the platform. Yeah. So as I was saying, we're talking today about hierarchies in healthcare and how that looks, what is the outcome of that, and shifting over to collaboration and networks, why that's important, and how we could make that happen. So, Ross, would you like to start
Sure.
out with what hierarchies look like in healthcare?
Sure. So, from my perspective, over the years, I've heard people focus and talk a lot about silos within organizations. So maybe within a integrated delivery system, hospital-based system, how maybe the departments don't exchange information or collaborate as much as they could, or within like a managed care organization, do the care management people necessarily have as much give and take with some of the community people who are focused in that? But I think the greater opportunity here going forward, and what I think you're really passionate about, Athena, informing Zena, is how do we kind of think about the fragmentation between different organizations within a local community? Because I've seen a lot of overlap in what two different organizations are trying to do for an individual, and I've seen gaps where people aren't getting the support from any endpoint in the system. What do you think about that, Jennifer?
That all sounds really good, Ross. When I think of healthcare and fragmentation, I think of different the first thing that comes to mind is really just different departments not working together, one department not knowing what the other one's doing, and you know and them not being integrated very well. So you know I feel like the way that you just suggested is all very good points in trying to bring everyone together.
Yeah, I totally agree. The way that our healthcare system is built now, we have it's both a hierarchical system and it's very fragmented. We have a lot of silos within healthcare where people and providers aren't really communicating. And so that leaves patients falling through the cracks. It makes it really hard for them to navigate the healthcare system, and it creates a lot of redundancy. And so a lot of tests are done over and over because there's not communication. Sometimes the medical records are different from one institution to another. And so there's not great communication between institutions themselves and between providers. And I think we have an opportunity to shift over to networks where we have people, networks. I want to make sure that everyone's on the same page with what a network is. Um, it, it is a kind of a web of communication where there's information and resources that are shared throughout the network. So um, a network really is a connector. It's connecting everything, and it's the leadership is dispersed throughout it. So members in a network are sharing different um, decision making roles, and rather than in a hierarchical system, the leader at the top is a decision maker, and people can't act until they have given the orders. So hierarchies, serve a purpose, but networks can really help to distribute the information and the resources across sectors. So we could have more communication between the community and, different resources within the community, like for transportation and for like food banks and things like that between the healthcare institution. So having those networks distribute that information and resources across could totally revolutionize healthcare.
And I think there are some pockets of this happening today. I think there are best practices that we can build on. For example, in the Medicaid managed care world, there's a concept of an interdisciplinary care team, where for people who are determined to be through assessments higher risk, they're what I'd call multidisciplinary group that meets, or in the clinical world, you might call it rounding. But this is outside of the clinician's organization. It might be a social worker, somebody representing the school system, somebody representing the family, and they have a conversation from time to time talking about the care and service plan. And is this meeting the needs of the individual? And is it based on their preferences? And if there are gaps identified, those people can talk and think as a network, as a system, not just from what one stakeholder's point of view is.
Absolutely. Yeah, I love that example, Ross. Thank you.
From my experience, I see a lot of it as well. When you're going in and out of different hospitals and working with different clients, you see a lot of that fragmentation, that separation of care, especially, when patients feel like they get passed around, certain, different roles, saying, well, that's the NA's job, that's the RN's job, that's, different, all of that separation, of course. And now, of course, they, different roles do different things, but there's less of a willingness to jump in and just kind of like help out where it's needed. It doesn't feel like it's together. It feels like a lot of it's separate. But Athena, you could expand on that more. You have some experience in the clinical space, right?
Yes, I do. Yeah. So sometimes we have kids who have chronic diseases, and they may, come from like a multilingual family. And so they have all these different challenges accessing resources at times. So I'll just give an example of like a child that comes from a Spanish-speaking family. They have a chronic disease. Perhaps they also have mental illness, like dealing with depression and suicidality. And their family has difficulty in getting healthy foods due to lack of resources and not having transportation. So that's a family that would really struggle in our current healthcare system. They would be seeing their PCP who, may not be communicating with their specialists, and they struggle with being able to navigate the system with, having a different cultural background and different language, and having trouble getting to appointments because of transportation. So if we had a system where it was more connected and we were all working together, there is an example, the NUCA system of care in Alaska has a really great integrated system where you come into the clinic to see your PCP and your team, and there is like a behavioral health specialist there. There's a case manager or a community health worker. They have typically like a traditional, like a spiritual leader from their community. And they also have other specialists in that clinic, and a really good web of communication between the primary provider and those specialists. And so that's one, they can just walk in and be able to communicate easily with everyone there, get everything done in that one space, and then feel like they were heard and feel like they didn't have to wait 3 months or longer to be able to see a behavioral health specialist. They don't have to work so hard to advocate for themselves and find these resources that they really need. So, yeah. So that's just an example of what it could look like. And what I experience normally is families like that would absolutely struggle coming into, I work in the hospital, so I typically see kids once they're really sick, and we oftentimes don't know a lot of their history. We can't really see a lot of the notes from their primary care doctor, and there's just a lot of disjointed.
I feel like that happens a lot when patients have more than one diagnosis, and especially when chronic diseases get involved or behavioral health specialties. You know, I think a lot of these viewers on here are going to ask, what does this look like for my hospital? Or what does this look like in my healthcare facility? And I think you helped spell it out really well of how this could look for a particular patient. I think the next question we need to ask ourselves is really, how can we better address it? Or what are the next steps that people could take today to better address? Anyone have thoughts?
Well, Athena, I like what you've laid out in Xena is bringing together people from different backgrounds and different disciplines within healthcare and social services, identifying some training. So you've got some examples that you shared, and I know you've been involved in, but bringing people together to develop a shared understanding and to think about methodology and some examples. And I think after that training of a community of people who are able to start to work on some real projects in the future.
Yeah. I think that's the first step, is bringing us all together, having that network across sectors, people in social work and, pharmacists. And then we could have lawyers, people out in the community who want to advocate for patients. We can have people from all walks of life coming together to talk about what they envision for healthcare. And in a network, instead of there being a centralized leader, there's a centralized purpose, and we're all moving towards that purpose. And we can, based on our different experiences, our different skill sets, we can take on roles within that network and work together towards that shared purpose. And I've seen that work really well with humans in different walks of life. I've seen where when humans are working together toward a shared purpose and they have passion and they're communicating, that there's an incredible amount that we can get done. And so I think in Xena, the idea is that we're all working together, we're networking, and we are learning about what's already working out there in the community. There's so many really incredible programs like the NUCA system of care, City Block, all these things that are really amazing that we can learn from and then bring out into other communities. Yeah, so yeah, I think the how, some people get stuck on that part, like, how is this possible? This sounds like a pipe dream. It's not possible to change the healthcare system. It's too rigid. Everyone's stuck in the status quo. But I think it absolutely is possible, because we have people like yourselves who are passionate and ready for change and ready to get in there and start working towards a shared purpose. We have networks that are forming out there, like Health Reinvention Collaboration, that's actually bringing other networks together. And we can create a whole web of people who are really passionate working together and shifting the healthcare system. So, yeah. Ross, have you seen a lot of networks? Have you come across a lot of networks in your work?
Yeah, I have been working around the country a lot with primarily with Medicaid managed care over the last 15 years. I've seen a lot of progress and literally improvements in measurable outcomes, whether you're thinking about healthcare outcomes or quality of life or even medical costs, when people from different organizations and even to your point outside the healthcare system start to think about transportation to medical visits, if there's food insecurity, matching people up with food banks. I'm real energetic about the idea of these closed loop social determinant systems where people from community-based organizations who are providing those services are entering information in so that physicians who are, quote, prescribing these services based on the results of assessments, that they know that the loop has been closed.
Yeah, I love that. So closed loop communication, everybody understands where, like, we're all on the same page. So that's really great. Yeah. Yeah. With collaboration, we've seen a 16% drop in mortality in some healthcare organizations that have really developed collaboration within their organization. And that's massive, 16%. And yeah, patient outcomes are hugely impacted. There's a 30% drop in medical errors when we have collaboration and good communication. So it's absolutely so important that we shift in this direction and bring access to resources that people need. So
Absolutely.
I mean, just from my experience alone, there's a lot of people that talk about making a change in the healthcare system, but there's not as many people who talk about it that end up doing it. So the fact that we are going to be doing it and making a huge change in the healthcare system speaks so many volumes. And, just from my experience alone, there are so many groups out there trying to make the change, like you said, the Healthcare Reinvention Collaboration, and some of the other organizations as well that I know of. And just from my experience, there have been, once you enforce the right collaboration, the right networks in place, and the right solutions, however you want to name it, there's just so much. It not only reduces medical errors, but saves the provider's time, because instead of having to bounce from this department to that department to this one, they now just look in one solution and they see it all integrated together.
Yeah, that absolutely reduces time. It's a cost and time efficient. And it also has been shown to reduce burnout. And, we have 50% of providers reporting burnout right now in our healthcare system, and so many people leaving the healthcare system because they're experiencing a lack of autonomy, and they don't feel like they have a voice in the system. And there's also a lack of cohesiveness within the healthcare teams, and that can really wear down on providers. And so if we're working together as a team toward a shared purpose, that can absolutely reduce burnout. They've seen it reduce burnout in organizations by 30 to 50%. So it's pretty.
Burnout's a really good topic, Athena, because, I'm sure the three of us could talk for hours about burnout and how prominent of an issue that is in the healthcare system. But I see a lot of places when they see burnout, they bring in a nurse well-being team or a counseling team for the nurses, or a hotline they can call. Or they look at the way they need to be staffed. But I feel like while all of those solutions are really great, we all know that they're quote unquote Band-Aid fixes to the problem, because it's addressing the problem after there's a problem. Instead, why don't we address the root of the problem before there's a problem?
Yes. Yeah, I totally agree, Jennifer. Yeah. And that's also seeing the nurse or the provider as the problem. They're the one that needs to be fixed with these well-being programs. And it is, of course, important for people to be caring for their well-being within the system. But what about the system itself? That's the root of the problem, is the people within the system are feeling like their values and what they want to do in healthcare isn't in line with what the system is doing. And so if we shift towards really working together towards a shared purpose that everybody can get behind, then that gets to the root of burnout. So
Yeah, they need to be looking at it from more of a holistic approach, like what ZNA aims to do. And holistically, you need to look at the root of the problem. You need to look at ways to prevent the problem. And then, when there is a problem, it's good to bring in those other tools, like the nurse well-being and the counseling and the hotline they can call. It's always good to look at that, because it's not going to reduce burnout to zero. We're being realistic, but it is going to help fix the problem probably more dramatically than what's out there currently.
Yeah.
Ross, do you agree?
Yeah, I agree. I really like the things that you two are talking about, because it's consistent with the quality movement. To your point about the system versus the individual, I remember reading Edward Deming, the famous quality guru in the past, said that based on his research over decades, 94% of poor results are due to the system, the process, and less than 6% are due to the people performing the process. So I think that that's really important to know that we're working together and we're on the same team. And I couldn't agree more, Jennifer, with just the concept of root cause analysis. I work a lot with organizations where everyone's very busy and they're motivated to find the solution quickly. And I feel like often people feel like they, quote, know their customer, they know their organization, and they want to jump to a solution, but they may not do as much research. They may not plot the data and use some statistics. And then they don't necessarily get to the true root cause. So then you slap a Band-Aid on, you think it's the solution, and then a year later, the team's back around the table saying, the results haven't improved. What are we going to do now?
Exactly. And, I think, Ross, to your point, I tend to look more at the operation aspect and the quality, because my background, even though was in healthcare, that is mostly my background is operations. So I'm looking at the how-to and and what are the moving parts behind this of how we can improve.
Yeah, absolutely. I think, also looking at the patient themselves and our communities at the root cause of their illness and what it is that they're coming in for. We often slap Band-Aids on, do quick fix solutions. They may come in because they have, let's say, they are struggling with abdominal pain and have all these symptoms. And we may give them a medication to reduce, an acid reducer or something like that. But we haven't asked them many questions about their lives, what's going on with their family, what stressors are they experiencing. And then, once we dig a little bit, we could uncover some things that we could be able to address. And if we had networks where we were communicating with other entities within the community, let's say they're really stressed because they have 2 jobs and they don't have childcare. They have difficulty accessing healthy foods. These are things that we could help people to access, and perhaps a lot of their symptoms would, go away because we're addressing the root issues. So yeah, I wonder, Ross, have you seen addressing these sort of social determinants of health have a big impact on people?
Yeah, anecdotally, I've seen that, and I know there are some. I don't have that memorized, but I know there are some national studies that are starting to show results in terms of satisfaction and outcomes, specifically tied to closing quote gaps in care and addressing some of these health-related social needs.
Yeah.
I've seen it too, Athena, and it's it could be something down to, even down to the patient support system, the patient's feelings on, their culture. It could be, I don't know all of them off the top of my head, but I know there's also socioeconomic factors that could come into play, or different health disparities that are definitely affecting, the exasperation of their illness, because it may be something a little bit more than just physical.
Yes, absolutely.
Sure.
Yeah, a lot of people struggle with health disparities in this country. We see a huge gap in outcomes for certain populations, and these are things that need to be addressed if we really want to improve the health of our communities as a whole. We need to get to the root of these issues. So, yeah. Well, thank you all so much. Does anyone have anything they want to say here at the end?
I'm just excited about getting started here with the group.
Yeah, I'm so excited. I feel like we can do so much together.
I'm very excited to kick it off. New year, new program. Very excited.
Yeah, so for everyone out there, ZNA is open for people to come in. There's a community space that's free if you want to just join and see what we're all talking about, join in the discussions, and be a part of shifting the foundation of our healthcare system. Just reach out, and there's also, if you go to the website, www.znahealthnetwork.com, and click on Join the Movement, you can come right into the community space from there. So I hope to see a lot of you there. We want to hear your voices, and let's start this healthcare movement.
All right, thank you.
All right, thank you all. Okay.